record the whole...
No, we'll just take your intro. We'll just take it. I have a voice recorder here. So
okay.
That's fine, right?
Fine. So, I'm Yousuf. I've been associated with LVPEI Institute for 7-8 years, and I started my career as a trainee here. I did my eye care management training. Then I've been associated with the patient care activities for 7-8 years. I've been recently shifted to the education center. That was the reason Dr. Rao has told me that I should be taking care of the patient care activities when people come here. This is your first visit to LVPEI Institute? Okay, so LVPEI Institute was started in, whole idea was of Dr. Rao, Dr. G.N. Rao, who was a very famous ophthalmologist in US, but he wanted to set up an eye hospital of that nature at Andhra Pradesh. It is his birthplace, Guntur, but he wanted to set up something in Hyderabad. At a time when he was looking for substantial funds and a good place to set up the hospital, he happens to meet Mr. LVPEI, who is a very famous film producer. You might have heard of movie Ek Duje Ke Liye. That's one of his very famous movie. The revenue which he generated out of that movie, he wanted to donate it for a noble cause along with this land. Adjacent is the Prasad Laboratories, which is still functional.
That movie was
That was in 1984-85.
Yes.
So at that time he wanted to donate some land. So in 1985-86, Dr. Rao and Mr. LVPEI met with a common friend in US, and Dr. Rao presented the idea of starting an eye hospital, which he liked, and then LVPEI Institute was born. With the help of his friends in US, he was on his way to start LVPEI Institute. First patient was seen in 1987, June 1st. So this 1st June we will be celebrating our 23rd anniversary. Now we see around 750 outpatients every day and operate around 100 surgical cases. Out of that, 50% are done absolutely free of cost, irrespective of what kind of surgery it is. A minor surgery like a cataract surgery till a complicated surgery which involves retina is done absolutely free of cost to patients who cannot afford.
So currently the ratio is about 50-50.
50-50 for surgical intervention, and it's around 40-60 for the outpatient. 60 is 40 free and 60 paying patients. And on a whole, LVPEI Institute works on 6 components. The 6 components being hospital, clinical research, rehabilitation, product development, education, and community eye care. These are the 6 wings that we work upon, and we try to develop a network throughout Andhra Pradesh so that by Vision 2020 we will not have anybody who is going needlessly blind, at least in state of Andhra Pradesh. How we are trying to develop that network, I'll show you in the future.
Okay, so you have hospital, clinical research, we have product development, community care,
Eye care and research.
That's
hospital. Education.
Education. So that's the medical world.
Yes.
I think
That's not a